Hello Atlanta, welcome back. We are here today at JC Plastic Surgery in our support of Breast Cancer Awareness Month this October. Today we're going to learn about a unique procedure here that many women are pursuing after breast reconstruction that is considered the final touch or the icing on the cake. Okay, Denise, you gotta tell me, what is it that you do here at JC Plastic Surgery? What is that icing on the cake?
Well, when patients come in after their last surgery, after reconstruction surgery, after they're all finished, we restore their nipple and areola to the original, or close to an original color, and make it look as natural as possible. Sometimes patients lose them in surgery. Sometimes they don't want them put back on. We can create different types of tattoos for them. It all depends on the individual.
So Denise, who is a good candidate for this procedure of nipple tattooing?
Typically, anyone's a candidate. Anyone that's post-op, whether it is 3 months, 5 years, anyone that desires to have the natural look of a nipple and areola back, we can tattoo it back on.
So this is a very artistic, almost like a painting. How do you and your patient decide on shape, size, color, all of those things that really matter in this, process?
Well, it's really important for me to have the patient involved. The patient always has an opinion. I want them to be involved as much as possible. We can choose the size, depending on a number of factors, the width of their shoulders, what they desire, what they feel they would look best in. I will take a marker and I'll draw different sizes on, let them know what they think. I'll mix different colors so they can decide. I really feel like each one is it's individual. There's just no tattoos alike, no two snowflakes alike. Every patient is different, and my goal is for them, when they see themselves, when they look in the mirror, it's something that after a while they don't even notice it because it looks so natural.
So how long is the typical amount of time that a person is in your chair with you?
I typically schedule about 2.5 hours. The entire time isn't for the actual tattooing. We choose color, we choose size, we talk about what we're going to do, we talk about how we're going to do it. If it's 3D, if it's not 3D, but like today we're doing a color correction, so we're mixing up color, we're adding color in certain areas, we're adding a little depth and dimension to the tattoo, and still in the end it adds up to about 2.5 hours.
Okay, so each session is about 2.5 hours. Does that mean that there's touch-ups that are required, or does a person have to do several sessions? How does all of that work?
Depending on the result that we're going for, depending on skin type, there's a number of factors that account for that. Certain fair skin tones, maybe we're going to be layering color in, we want to layer light color in, we might want to let it heal a little bit, let the ink get down in the dermal layer and build on it from there. Depends. Darker skin tones may grab the ink a little bit faster. Everyone's different. There's so many things that really influence someone's skin. Your skin's your largest organ. Medication, the way you care for your skin, the things that you do. So typically 1 to 2, but no more than 2.
Okay, so the procedure's done. Everybody's happy with the color and the size and feeling great about things. So what are you sending this client home with? What's the aftercare like?
Patients frequently call and ask. They'll say, can I drive home afterwards? What can I do? What can I not do? Of course you can drive. There's no medication involved. We have some aftercare. We'll give you aftercare products to take home with you. We do have a few restrictions, however, to stay away from hot tubs, swimming pools, lakes, streams, out of the ocean for a little while. So that's always a good idea to plan your tattoo around a vacation or something like that. I'll give you you can continue everyday activities. You can play tennis, you can go out for a walk or run, whatever you normally do. I'll give you an aftercare product to use, a lotion, or depending on the time of the year. I tend to give more of an ointment in the winter when it's drier and a lotion in the summer. You'll apply the aftercare products twice a day. You'll keep it covered for the first day or two while you have your clothing on, just to keep the area clean and keep your clothing clean. Then you'll just continue to use the lotion if you can. Tattoos need air and moisture. If you're at home, you could just wear a light t-shirt and a little bit of lotion. That air will really help speed up the healing process. You really should see your healed up resolve within a week.
Denise, thank you so much for having us out today. I feel like we have a little bit more of an understanding about this unique procedure. Atlanta, what makes a woman feel whole again after reconstructive surgery is different for each individual. This unique procedure can offer those women the look of what their breasts looked like before surgery.
Thanks for stopping by, Holly, and thank you, Atlanta. We're here to answer all your questions about tattooing. We work with whether you have questions about your skin type, the type of tattoo, you want a 3D tattoo, you want a makeover of an older tattoo that's faded, we're here to help. Just give us a call.